Recording in progress. Okay, so welcome everyone. My name is Lisa Kelly. I am Executive Director of Mental Health Awareness of Michiana, and we are delighted today to talk about SB1 Human Service Matters. And we are going to be hearing from Representative Maureen Bauer and from LaKeyue Williams, who is a community member and business owner and advocate in the community. So for anybody who's not familiar with Mental Health Awareness of Michiana, we are a local nonprofit with a focus on removing stigma related to mental health, mental illness, and encouraging collaboration in the community, but also working on removing barriers to care. So the reason that we are interested in SB1 is because it really can have a direct impact on access to care. And we're already getting some inkling from the community that people are already starting to lose benefits. So we as an organization are doing this advocacy webinar just to help the community understand the legislation and also to start thinking about implications. And finally, what can we as community members and organizations do if we're seeing that people are starting to lose access to care. So we're going to start with introductions, but also we will weave in questions into the webinar, and everybody should have access to the chat. So as we're going through the hour-long webinar, please feel free to put your questions into the chat box, and as we have opportunity, we'll see if we can get those answered for you. So thank you so much for being here today. Representative Bauer, would you introduce yourself first, and then LaKeyue, would you also just do a little bit of an introduction too?
Of course, thank you for the opportunity to join you today and to have a discussion about the impacts of Senate Bill 1. I am State Representative Maureen Bauer. I am in my 6th year in office, the 3rd term. We serve 2-year terms. We are a part-time legislature, so we are generally in the district when we are not in session, and we are in session January through March or January through April. So I serve on a number of committees during that time. That are standing committees, including public health, which is one of the more busier committee meetings. I'm also on judiciary. I'm served as a member of courts and criminal code and environmental affairs. So that is the regular business that's done during the legislature, where we hear bills and amend them before they go to the full House and then are sent over to the Senate. We are in our interim now, and soon we'll be meeting to study topics. There have been a number of issues that have been selected to be studied this interim that would then likely become legislation come January. So now is the time to be having these discussions and molding the policy that we will be taking up in January. So thank you for the opportunity to join you.
Well, hello, everybody, and thanks for the invite, Lisa. My name is LaKeyue Williams. I am a South Bend resident. I am also a community advocate. I've been in social services and human services for just over 20 years. A few years ago, I started my own business, Divergence Business Solutions, so that I can help organizations, small business owners, and government with some of their programs, some of their projects, and most recently, I've worked with both the City of South Bend and Elkhart County with some of their initiatives. So I'm very well aware of the systems, policies, and how they're created, how they're developed, and then how it's rolled out and the actual impact that it has on people who are accessing those. So again, thank you for inviting me here, and I will speak from that lens, how these policies impact the population, how it shows up in reality versus just how it's written.
That's great. Thank you so much. So Representative Bauer, I'm wondering if you could get us started by just talking about Senate Bill 1, Human Service Matters, describing what's contained in the bill, how it came about. That is really kind of the starting point for all of this is help us understand what's in the bill that was signed by the governor and goes into effect July 1st.
Right. Senate Bill 1, now Senate Enrolled Act 1, was introduced as Indiana Senate Republicans caucus top priority bill. In the Senate and the House, they are numerically ordered in terms of high value to the policy that they want to pass. So Senate Bill 1 was one of the major issues that they brought up this past legislative session. The bill makes major changes to Indiana's Medicaid and SNAP food assistance programs. So as we've mentioned on this, when talking about having this call, that a lot of supporters describe the law as a way to reduce fraud, to improve some accountability, and encourage workforce participation, while also the goal is to ensure that benefits are reserved for a certain eligible criteria resident of the state of Indiana. On the opposite side, many critics have raised concerns that this will provide many more administrative barriers and could cause people to lose eligibility, lose their health care, or lose food assistance coverage. So the bill passed out of the Senate first, a vote of 38-9, and out of the House 64-30, and again was signed into law by the governor and will go into effect July 1st. So there are about 5 different parts of this bill that I wanted to break down. The first is that there will be more frequent Medicaid eligibility checks. So one of the largest changes will require those applying for the Healthy Indiana plan to undergo these eligibility checks rather than annual review, which is current practice. So every 6 months, recipients will have to face these checks along with a quarterly verification of income and these new work requirements. The bill also allows changes in income or circumstances to trigger an eligibility review or potential loss of coverage. Again, the supporters argue that this will improve the accountability piece and reduce improper enrollment, going after what has been talked a lot about as this Medicaid fraud. We do have a new governor, so they have new head of FSSA and brought in a whole new team. So this has become a priority for that administration to go after fraud in the Medicaid system, which absolutely we are accountable to run the agencies as effectively and efficiently as possible. But the concern with those who oppose this type of re-eligibility requirements is that something called a coverage churn, where people temporarily lose healthcare because of paperwork and red tape involved in government services, or simply some procedural issues, even though they qualify or are eligible. The second area is this new work requirement. Last year, Indiana passed a 20-hour-a-week work or volunteer requirement. That could not go into effect until the federal government passed a similar requirement. So now the Senate Bill 1 that will become law requires able-bodied adults aged 19 to 64 to verify 80 hours a month rather than 20 a week of either combined work, school, job training, or volunteer activity. This bill does require applicants to prove compliance for 3 months before applying. It eliminates that self-attestation that we used to have and narrows these exemptions. So exemptions can be for pregnant women, medically frail individuals, if you are homeless or experiencing homelessness, a veteran exemption as well. And also if you're currently undergoing a drug treatment program or a student. This is one addition I added last year. Students find it very difficult to be working 20 hours a week. So now we allow exemption for part-time or full-time students or vocational programs, students in vocational programs, and if you are a parent of a minor child under 14 years of age. So ideally, if you're taking care of a dependent, that is your job. That is your responsibility. So it's very hard to make them take on this additional work requirement. Also in Senate Bill 1, it eliminates Indiana's ability to create broader hardship-based exemptions beyond what is federally defined by those categories. So that would include exemptions related to natural disaster, medical emergencies, or local unemployment conditions. The third change in the bill is related to SNAP or food assistance eligibility. So the bill lowers asset limits. It increases verification requirements, eliminates those broad-based categorical eligibility, and seeks federal approval to prohibit SNAPs from, which we might have all heard, purchasing candy or soda. So the asset limit drops from $5,000 to $3,000 for most households. And the fiscal analysis of this bill estimates that thousands of Indiana households could lose SNAP eligibility because of these changes. The fourth area is immigration verification requirement for Medicaid and SNAP applicants. Again, the supporters describe this as strengthening the program integrity and along with compliance, but those who oppose this section of the bill raise concern about mixed status families. So say if you have children in the home who are legal residents, but mom and dad aren't, that will be very hard to prove that the children are eligible for these benefits. That many who are applying will no longer because of fear or confusion or just simply uncertainty if they are eligible. And then finally, the last aspect of this legislation is the creation of the Rural Health Transformation Fund. So this creates oversight mechanisms to Indiana's shared federal Rural Health Transformation Fund. So we are expected to get about $200 million intended to support rural health care access. Now, if you think about the Health First Indiana Fund that was part of the Holcomb administration, they had $225 million in new funding in the 2024-2025 biennium, and that was for the state. So this is going to be targeted and narrowed just to rural communities. So the debate is whether or not those resources will be sufficient enough to offset larger healthcare funding pressures facing rural hospitals and providers, which we know we are having hospitals shut down. We already have about 33 maternity or hospital deserts across the state. And it's a broader discussion about how we can support our hospitals and our institutions. So much of this debate was focused on policy and eligibility systems. The larger question facing us moving forward is what happens when people lose this continuity of care. The Health First Indiana funds were about public health care access to expanding services of areas focused on maternal and child health, trauma and injury, also lead exposure, and it was led by local health departments to invest that funding wherever they needed to. In St. Joseph County, there was a poll about what areas were most important to our community, and that money was sent specifically to those health programs to have greater health outcomes. And where will people turn if they don't have healthcare coverage? Will we have more of a burden on our police force who are responding to emergency calls, or our trauma centers that do 24/7 emergency care? Will we have more people going to the ER, or what will be the real world impact for many individuals who have mental illness or chronic illnesses, disabilities, unstable housing, or inconsistent employment, people who work seasonally part of the year. And so these are already very difficult systems to navigate. And so, a person who is suffering from bipolar disorder may miss the paperwork during a depressive episode. Someone with schizophrenia may struggle with the organization or communication to work with the state agency. Someone who's chronically ill may technically be able to work at some times, but not consistently enough to satisfy this monthly reporting system. So we know that even a temporary loss of Medicaid can result in interruption of medications or canceled therapy appointments, delayed treatment, relapse, or other sort of crisis intervention, or even hospitalization. So looking at what the impacts of this legislation will be on local systems is part of the conversation. And at that point, I think it's perfect to move into the LaKeyue.
Yes, thank you. Thank you, Representative Bauer. That was great. So I'm just going to follow the same 5 points that you pointed out. And so again, when I look at these issues and when I read the legislation, is I'm looking at it through the lens of application, and I'm also looking at it through a systemic lens. So systemically what it means, and then in application, what does that mean? So the frequent recertifications, this is obviously, yes, a way that systemically you can ensure that everybody is qualified, the T's are crossed and I's are dotted. But in application, that's going to be a really, really hard thing for our families who are transient, who are navigating crises, who just are in a position where routine and stability and organization may just not be their strong suit at that time. And so this is absolutely where larger organizations are asking themselves, how can we help? What can we do? Because this also impacts them. If you are a service provider who receives Medicaid funding, if you are billing Medicaid for services that you provide, your clients, your patients' eligibility will impact your income and your revenue or your ability to be compensated for. So one example of organizationally what you can do is create a process or a system that really helps the organization, helps the client stay on track of their certification dates. There are case managers often who could be in this place, or new terms such as navigators are being explored and used, but I would definitely encourage any organization that gets a significant or any portion of their revenue stream through these insurances, that you begin to think about how do you support your clients and your patients in staying on top of the recertifications. So this latest version is maybe once every 6 months, or if something kick starts it. So it can be consistent, but it could also be out of the blue. It can. I would talk to each client about, the other, I would say, proxies that you can add to your case who would also get your mail. I do believe that that is an option when applying for and receiving these types of benefits, but definitely the recertification is going to come much quicker. And it will impact, obviously, the patient's ability to be insured at time of being seen, and then the service providers, if they're doing the service, when and if they can be compensated for that. So that definitely has a two-pronged effect. The work requirements, yes, 80 hours a month is what we're looking at now. Um, Taking into account students who and caregivers of young children. However, all of us are kind of seeing the shift in the workforce. The unemployment rates are absolutely skyrocketing. Um, certain industries, especially the nonprofit world, is being hit heavy when it comes to losing grants and losing financial supports. So quite honestly, it's not going to be unusual to see people unemployed or working fewer hours. Um, with the work requirements, one thing about that is the state will now do, their own auto verifications. So there's systems that they will be able to tap into to kind of monitor and verify these work requirements. So that would be something worth talking to your clients and patients about. For anyone who has generational experience on these Medicaid programs or SNAP programs, this process is very different than what they're used to. Typically, you were going through um, annual recertifications that looked at the hours that you're working. Um, over the recent years, we've been seeing more of a automatic verification process. Like you may have a client who just receives a letter out of the mail that says, "We have been informed that you are now unqualified." So that is absolutely something that is going to have, I mean, a major impact on our single mothers, which then, I mean, if, yes. Yeah. I want to talk about the SNAP because obviously SNAP, we're talking about the ability for a family to feed their children with the rising cost of food at this point. Um, I have been a person who, throughout my life, I have been on SNAP. I've been off of SNAP. I've applied for them myself. I've helped clients apply for them. I've helped family members apply for them. What they're commonly used to in terms of your income eligibility, that has been reduced significantly. As Representative Maureen mentioned, 5,000 to 4. So depending on the household size, right? So people working with families who are in need of SNAP, really, it's a responsibility for you to become more aware of what those eligibility criterias are, so that not only can you can provide it to the family to read, but also help them understand it. So I think it doesn't help that we assume that the comprehension of what is read or said is there. And so as professionals, we want to make sure that we understand these changes and that we're able to communicate and really reinforce these changes with our populations that we're working with. Now, one reason why I wanted to spend some time here on this SNAP is because this change will conflict maybe with other programs that your clients may be a part of. So if you think about a family who has an economic goal of paying down debt or buying a house or buying a new car. And so the city of South Bend has a program called the Financial Empowerment Zone, this financial empowerment program. One of their KPIs is increased savings. It's really important that these professionals who are working with these families who are wanting to do a good job, right, getting them up and out of poverty or to have a financial goal so that you can buy that car, so that you can take this course or have your down payment. Those things could impact their SNAP eligibility. So right now, if you're saying $3,000, depending on the household size, that literally means this family cannot have more than $3,000 in any combined accounts. This is not just earned income, this is saved income. And so in the past, the number was a little bigger, but it impacts people who are trying to work their way out of poverty. They have removed a lot of those cushions, a lot of those bridges, and some of that time that could allow you to do that. This will also the income eligibility will also be impacted by any promotions or raises on the job. So as we talk to our clients about better employment, getting better skills, I mean, accepting a $1 raise at work, maybe moving positions. This can impact their monthly SNAP benefits. And now, in addition, it could impact their children's eligibility for insurance or their eligibility for insurance. In the past, I have heard that it was almost easier to be poor financially because, and that can sound insane to hear or understand. But when you think about a family who is trying to get out of poverty, if a 50-cent raise can kick you off your Medicaid or off of your SNAP benefits, and now you have a $500 grocery bill, that 50 cents does not supplement that. And we think about this in all of the ways that one income change could impact their housing subsidy. So now you're paying more in housing, you're paying more in food stamps, you may be removed from Medicaid or put into a program that may have a copay attached to it. So yes, working with these families is going to be very important that the professional themselves truly understand what these income maxes are and how goals that this individual family may have could impact that and really help strategize around that. One way that I've seen this happen is through the IDA accounts, which are individual development accounts. They have been offered through Real Services and La Casa, and it not sure if they exist anymore with our new federal administration, but this was a supported program that allowed families to save, and then I'm not sure if it was I'm thinking it was a federal, that it was a matched funds. So let's say for every dollar that the family saved, the it was matched by four. Now, the amazing thing about this program was that those monies could not be used against them as income towards their benefits. That was written into the program, and unfortunately, the financial empowerment program that we have just recently, that is not an IDA program, so it does not offer that same type of protection. Moving on to immigration and immigration verification. Now, there will be more automatic system verifications. So if we look at where we're asking our immigrant families or undocumented families to engage with systems and you're capturing their information, is really important to understand that the changes to the immigration qualifications, they've kind of reverted back to some older statutes, 2014 and 2012 statutes, which were way more limiting. And so, in specific, so now under immigration, Cuban refugees, Haitian refugees are specifically identified as ineligible. So it's really important to understand the status in which your immigrant families are. As Representative Maureen mentioned, this is a huge concern for mixed status families. Not only just the fear, right, of being known if you're undocumented and at risk of deportation, but that undocumented person's income could be used against the citizen who qualifies for these benefits. So, I mean, Representative Maureen made a case about a child, but say a young adult, right, who's living in a home, a multi-family home, and someone in that home is undocumented. That person has income. That income could be used, and they can do these systemic searches, these automatic searches through these databases that they absolutely have access to. And the warning in the language of the legislation is if someone who qualifies applies and through the verification process they find a member in the House who does not qualify and is undocumented, they will report it to Homeland Security. Very important. Now, I'm not as familiar with the rural funds. One thing that is really important to note is the language that it is going to be continuously funded. What is the word? Continuously appropriated. That money does not go back to the state for general funding. So anybody who understands grants, a lot of times if you don't use it for said purpose, It's then returned to a general fund to be dispersed out. It specifically says that it will not revert to those general funds. Also important to note systemically that the state cannot expand these programs unless the federal government approves it. So whatever reasons that they would like to do that, let's say a natural disaster, another pandemic, you have to have the federal government's approval, which really caps kind of that state's rights and what they're able to do with funding in that regard. Important dates to mention: July 1st, where the candy and limits to SNAP rolling out. But in October 6th is when the immigration, we can expect a lot more synergy between FSSA and maybe Department of Homeland Security. Um, Written into the statute gave a wide range. I think there was one of these sections that begins in December of this year and rolls out to December of 2032. I I do want to read more on that. That's a more a policy thing, but what I'm seeing is a difficulty at the application level of these services. So the families who would receive them, lots more barriers, much more difficult to apply. And then at the systemic policy level, strong language to really cap changes. Um, Also important to note the office, the Secretary of State. So a lot of this is going to be monitored and overseen by the Office of Secretary of State. But this legislation reads very distinct. There are things that the office can do, and there are things that only the secretary can do. And a lot of that is around decision making, allocation of funds. So a lot of administrative things like keeping track of reports, running the verifications. It reads like, okay, anyone in the office could be responsible for that. That's an office responsibility, but it really gets specific to the secretary can only modify, change, allocate, things like that. When I read that, there's some power in that person. I have no idea who the Indiana Secretary of State is. Not sure if that is a position that is often competitive, if it's contested in campaigns. But what I am seeing from the two lenses in which I look at these things from is systemically, there has to be some changes. There has to be some systemic changes. More people involved in politics to ensure that the person who would be appointed or elected or made responsible for some of these things, um, that yeah, that they're doing what the constituents of Indiana would want to do. Um, And I will leave it there to open up for questions. There's definitely a lot in this 26-page legislation. Each time I look at it, I see something differently, but absolutely for the point of organizations who want to advocate or are working with the clients, those five areas that we just covered will have the most direct impact, the most immediate. And another thing to note too, previously when when you would apply for services, especially Medicaid services, from the date of your application, it would go back 3 months. I think they've reduced that to one. So that's a major difference that is a kind of commonly known thing through medical professionals or patients who've used that. That will be changed as well. So I will leave it at that and be prepared to answer any questions you may have.
That's great. Thank you so much to both of you. And anybody is welcome to put into the chat questions that you may have. I'd actually love to talk to both of you just for clarification. In terms of eligibility, there's always been a system in place for people to recertify, right? So in terms of, what's really changed is the frequency of the eligibility checks. Um, and I mean, there's other things that you've mentioned as well. So for folks who are needing to like recertify more frequently, is this all a paper system? Is it all electronic? Like, how are people getting reminders that there's certification? If you've got a lot going on in your life, you aren't necessarily paying attention to every email that comes in or even every paper mail that comes in, and people do move. So, what's the system like now in terms of people knowing that they've got recertification coming up?
I like to handle that because recent situation, a family member received a notification from the Medicaid office. There was a delay in the time that it was mailed to the time that it was received, and then their due date to get things back was probably just then a few days away. So that really then limits, there's no mailing this back. You're either going to have to return this in person to meet that deadline, or there is now an online portal for clients. So you do have the convenience of uploading documents into this portal if you're tech savvy, if you have access to the computer, if you can get to a library. There are ways there. So for professionals who are working with these families, one of the easiest ways is uploading those documents into the portal. One horror story that I heard about this is a family member who has chronic heart conditions had to recertify. Again, a delay in the mail. It got there, maybe had a couple days to hit that deadline. She went in person with all of her paperwork, turned it in. It was stamped. She left thinking it's taken care of. Month or so later, she's informed again by notification that she had not turned in her documents. So she goes back up to the place because she knows where she's turned in the documents. And as unbelievable as it sounds, her paperwork was still sitting in the basket, untouched, with the date from February. And of course, because this was then a person era, they attempt they attempted to blame her for it, but they could clearly see that it just had not been handled. But those types of things are absolutely going to increase in occurrence. Um, there are a couple, I don't know about St. Joe County, but there's a thing called a website called Find Help. It is a place that you can put some of your important documents because again, once you get those important documents turned into the portal, then that remains there. So the family wouldn't have to necessarily keep carrying the originals around and keep providing those birth certificates. I haven't heard of anything about that changing yet.
So there's a question. I actually, I'm going to read this question from Ellen, but I also, Maureen, Representative Bauer, I'm curious when legislation like this is being enacted, is there discussion over how the system is going to adapt or, do they ever talk about, how to protect people from, getting the services, make sure they get the services that they need and that they're eligible for? Like, is there ever conversation in the state capital about what do we do to make sure that people actually do get care?
Yeah, so as I mentioned, the new Secretary of FSSA, Mitch Rube, came in with the Braun administration. He has testified in front of legislative committees, including coming before our House Public Health Committee. He, I think, came in wearing a hat saying "Make Medicaid boring again." So he's really enjoying his new role. And the argument was last year that there was a cap on eligibility. I don't know if you'll remember that discussion.
Mm.
And our argument back was if you want every eligible individual to have healthcare access, you should remove the cap. Everyone who meets this long, extensive, thought out list of criteria should be able to apply for this healthcare coverage. And they did remove that cap of enrollment. So that was one area where they agreed with the message of every eligible individual should have this program. It was created years ago, reinvented under multiple administrations, and it really should reflect our priorities. One of our major priorities is the health of our community, and we saw that through a global pandemic and all of the cracks in our healthcare system. And so this is a remarkable responsibility on this administration to deliver quality healthcare to those who may not otherwise be able to have access. As we mentioned, putting the strains on our hospitals or medical providers. We had long discussions about police shouldn't respond to mental health calls, and we had legislation change there. So that was one positive change where the cap of enrollment was eliminated. I did want to say something that I remembered in the discussion was one piece that was in the bill was a lot of it was to give a lot of authority to the Attorney General. This was a theme of a lot of the legislation that came through. And I just want to make sure, I think when they reference the secretary, they are talking about the FSSA secretary rather than the Secretary of State, but we can dig into that a little more. But some of that immigration authority was going to go to the AG. We were able to roll that back and keep it within the office of FSSA. There was also a section that was removed by a member of the majority party, which is something we brought up in committee, that there was almost going to be a portal of immigration status. You had to report your status and they would capture it and keep track of it. So we got that removed so we don't have this strange criteria being collected just of status. So we wouldn't know what it'd be used for, but you just be reporting on people who get these services. Now they do have to, anyone who is helping an enrollee does have to declare their immigration if they are here as a legal resident, but what it would have been broken down by county, where in certain areas you could be easily identified as if you were from a certain region. And so we wanted to at least protect some of that privacy of individuals. So that was an area that we had some compromise.
Okay. So Ellen was asking, does an applicant have a specific contact for regular verification, or do they just get the next worker in line? So if somebody is applying for Medicaid or SNAP benefits, is there a regular person, almost like a case manager? And right, so at some banks, there are portals where one needs both a laptop and a cell phone. That's a whole other thing, is how do people, what access do people have to get their information actually uploaded or to the right entity? So, LaKeyue, I think I saw your answer here that it's the next person in line, right? There's not a one person who's assigned to a resident. It's just whoever happens to be managing the call for that day or the line for that day. Is that correct?
Yeah. The term case manager in these positions are very loose. I having built a beautiful career in case management, I had intentional relationships with my clients, and this is kind of one-off. You may never see their face. A lot of phone interviews, so you're able to see a person if you can get to the location. So I don't know if everyone is aware, they've moved pretty far, serving all of St. Joe County. And so I don't even know if buses went quite that way. There might be still a little walk if you do take public transportation, but access has been strained as well. And then contact with any consistent person is probably unheard of.
Yeah. So the eligibility changes affect all Indiana residents, right? It's not urban or rural. It's all people living in Indiana who are eligible have these requirements. For SNAP, benefits for Medicaid benefits. It'll affect every Indiana resident who is eligible. I'm curious that, the rural transformation dollars that are coming in, what are those going to support?
Good question. The doctor of FSSA created a presentation, Rural Health Transformation Funds, which it will be going into his first year, and it is a 5-year program. So that's kind of where those phase outs were. And then that 2032 was the sunset of this program, which is many administrations away. Maybe not. It's going to come before us, before we know it, but is led by the Department of Health and the FSSA to help meet some of these health goals, including some workforce investment. So they'll have regional grants that are going to help invest in, well, they have a phrase, make rural America healthy again, provide sustainable access. They're going to look at coordinated care, some payment mechanisms, or incentivizing providers to reduce healthcare costs. That's a major discussion at the state level. But of course, that's not an issue that's just focused in rural parts of the state. So we are essentially investing in one particular community and not the other. And quite frankly, we see a lot of the same problems with access to care that happen in rural Indiana also are happening in urban centers, where you can't afford your healthcare access. You can't take time off of work to make your appointment. In the rural areas, you may have to travel a little farther to make that doctor's appointment. But these challenges impact every family. And so we'll see once this is implemented what the outcomes are. When it comes to expanding technology, we have plenty of neighborhoods within the community that don't have consistent broadband access. And we know that that is important for healthcare, even, providing documents, as we said here on the call. So it's a wait and see, since it just will, go in effect here shortly. We'll be allowing the investments to go into 8 different regions of these rural communities. And so what happened with the Health First Indiana Fund is the local health departments had to report back every June and December with data points. So, the legislators approving these funds could see the real life impacts on the people that they serve and the communities they represent. And so I would hope that we'll see that as well, to see that some of these investments are driving change. But then hopefully we could expand it to every part of the state.
Okay, thank you. In the 10 minutes that we have left, certainly if anybody else has questions, put them in the chat box. So if you can imagine people starting to get thrown off Medicaid is maybe too harsh, but losing Medicaid or losing SNAP benefits, when they start getting cut off, what are they to do, right? What are steps, that they would have to take that, I appreciate, LaKeyue, you're saying the organizations, nonprofit organizations, healthcare organizations, mental health healthcare organizations, libraries. I mean, there's so many potential people who will be involved in helping to help people get back on their benefits. But what is the strategy that we should be preparing for? I mean, within my own organization, one of my staff told me that she's seen 2 of her families that she works with have already lost their Medicaid benefits. And it's not even July 1st yet. So there's, what can the reaction be that's productive, that helps people get back needed services, and certainly SNAP benefits, the food that people need to survive. So what can either of you speak to, what do people do if they get a denied notice, or what do organizations do if, to try and help get people back, what they need?
First thing I would suggest is definitely read over the paperwork thoroughly, and if you need to bring someone else in to help you understand that, do that. Typically, there could sometimes there's an appeal process that's just offered. I would take advantage of any appeal process, especially if you do believe that you were qualified and this was a possible mistake, administrative mistake. Outside of that, I have been talking to families about becoming more aware of food pantries that are in the area. I know that St. Joe County has many different food pantries that serves different areas of town, different zip codes, different ways in which you could qualify. This may be a way to just kind of supplement that pantry to have some shelf stable things while the prices in the grocery store are changing daily. The Unity Gardens in the summer, I would say for families who've never had to think about that before, this may be a time that you really want to get to know the Unity Garden in your neighborhood, the organization and how to access them. Um, and then outside of community, right? Like we're all, and a lot of people are going to all be on the same boat, maybe different positions on that boat, but talking to people to really find out what resources and supports are out there. I learn every day of something new. There's always people who and organizations that really want to kind of fill this gap and be of some support to people. But just off the top of my head, I would say for sure, appeal if you have a chance. Definitely get familiar with the food pantries and then meal planning. Stretch what we have. Meal planning has helped with whether you're spending cash or food stamps for your food. If we're intentional and strategic about our meals for the week, and depending on how you get paid, then you can stretch them and kind of see it a little better, reduce waste and fraud of our own money or waste and abuse of our own money. Talk to programs. Purdue Nutrition, they were available out, and they have taught many groups some really good tips in how to cook at home, how to stretch your dollars, whether it's cash or SNAP, because right now the cost of food continues to go up. Thinking about our babies. So we have infants who, I mean, I haven't had to buy formula, but I've heard it's up to $70 a can. Christ Child has gotten involved in providing diapers because they know this is, again, something that food stamps can't buy, but every baby needs them. Getting involved in all of those programs that can reduce cost in one area so that you can reallocate. Yeah.
That's great. Thank you, Representative Bauer.
Yeah, and I'll just add, 2025, our current governor opted out of the Summer Sunbucks program, and we will not be enrolling this summer either. So that is food for children throughout the summer months. And so we do have to be prepared for that. We have to, look into, we're really relying on our nonprofit organizations more and more. And I also, we talked about the fraud and that a lot of the supporters of this legislation was to reduce that fraud, waste, and abuse to the public assistance programs. But what we saw recently that many of the largest Medicaid fraud investigations nationally are about false billing or kickback schemes or, improper reimbursements by providers or corporations. Um, it in itself in Indiana is not generally the individual recipient. And so in those large scale fraud cases, that can involve millions of taxpayer dollars at a scale beyond the occasional paperwork or an eligibility error made by an individual. So we will see if many people who, and we'll lean on all of you community partners to see if people lose coverage because of these reporting burdens or documentation problems or it's unstable work hours, address changes. That's all that's really important for us to capture. And see if we're having administration errors, rather than this intentional fraud. So what the intent of the legislation was and what they are finding people are being unenrolled for will be the real judge of this piece of legislation and how it works.
So there's a question here. As we're meeting with clients, what should the messaging be now? So I'm hearing, number one, you need to know when your eligibility deadlines are. What else? What is the message right now to constituents? And I also, Representative Bauer, wonder, as people, because we all have different state representatives and senators, at what point do people let their elected officials know what's going on? So there's two questions there. What's the message to clients, and how should we be engaging with elected officials during this time?
Yeah, I think it's very important. I receive information about high utility bills and pass that on to the company, and what I'm hearing from the district about the burdens of the policies that we pass in the state of Indiana. So um, we have legislative assistants who work full-time year-round in the Capitol. So they do constituent service work. So if you're having trouble with any state agency, that's what we're here for. We're here to provide those constituent services for you. We can get directly to the legislative liaison in FSSA and ask for an update on the case. They will, of course, keep everything private, but we can see maybe where the status of the enrollment is, what documentation was not approved, and that sort of thing. As I thought about the messaging, we really are going to have to start promoting, with the QR code that you need to re-enroll, like the Medicaid unwinding that occurred post-COVID, where we were sending out emails of what that letter looks like, so you don't feel like you're being scammed or, have a fraud coming your way as a victim of, someone trying to, again, cheat the system. So we can do our best to communicate through newsletters, sign up for your state rep and state senators' newsletters, and hopefully they'll do their part and help educate the people in the district about the changes coming through this bill.
That's great. We are almost out of time. I really appreciate, so Councilman McBride would also like to help partner. So I think that's great to think about the local city council, county council, and what they can do to help get the messaging out. So I really want to thank you both for being here today, and thank our attendees for being here. This is a really important piece of legislation for the state and for people who really depend on Medicaid for healthcare benefits, mental health care, food, through SNAP. So there's a lot of really important things that I think may be impacted by this legislation. So I appreciate the opportunity to educate the community and start thinking about proactively what can we do to try and stem the tide of bad things happening as a result of this legislation. So thank you so much for being here. And I do want to let folks know that we will be doing another webinar in June on the criminalization of homeless folks, and that we'll get the date out. But if you want to join the MHAM newsletter, go to our website, and that way you won't miss that. And keep an eye on social media as well. I think that Representative Bauer, has a great way of communicating, to constituents as well. So thank you so much for being here today, and we just have to keep an eye on things and keep talking about it. So thank you so much. All right, take care.